Hi, this is Dr. Nishal, and in this video, we're going to be talking about inflammatory bowel disease, including ulcerative colitis and Crohn's disease. Now, both of these inflammatory bowel diseases in general are autoimmune. Um, they're conditions where the immune system is basically attacking the body, specifically in this case, the digestive tract. So the first thing that I would recommend people adding into their treatment plan would be Boswellia. Boswellia is it's a medicinal herb, herbal supplement. You can get it at most health stores, and it contains a potent anti-inflammatory compound known as acetyl 11-keto-beta boswellic acid. And what's been seen in studies is that it demonstrates the same remission-inducing effects. In fact, the equivalent remission-inducing effects to that of sulfasalazine, which is used in ulcerative colitis, and mesalamine, which is used in Crohn's disease. So Boswellia is quite an effective option for treating these conditions. In addition to Boswellia, curcumin, which is found in turmeric. Turmeric is a spice, a East Indian spice, that is gaining a lot of popularity for reducing inflammation, specifically by inhibiting the production of certain inflammatory cytokines. Cytokines are basically what regulate the immune function, inflammatory process. And by inhibiting this, the production of these cytokines, it plays a vital role in stopping the pathogenesis of inflammatory bowel disease, because cytokines and inflammation is involved in the development of these conditions. Also, in addition to this, recently it's been seen that Crohn's disease is directly linked to the presence of a certain type of fungus. So there's a fungal cause that's believed to be what causes Crohn's disease. So the cool thing about curcumin, at least turmeric, is that it is a potent antifungal. It's used for treating intestinal candida, as well as yeast infections, and even oral thrush. And so that makes it that gives it quite a it makes it quite a formidable option in treating this condition, because it's antifungal as well as anti-inflammatory, and not just it's a potent anti-inflammatory. I mean, you can go ahead and read all the research. I believe there's a couple thousand research papers done on curcumin and turmeric that show prove its efficacy in treating inflammatory conditions. Now, in addition to this, probiotics, intestinal bacteria, are extremely important in managing these conditions. Definitely getting them from good sources. You want to get it from kefir or from buttermilk. Or if these don't agree with you, you can just get a probiotic supplement, and that will help as well. Now, the final thing I want to talk about is the most important thing in all autoimmune conditions, and that would be stress. Stress is the #1 cause of autoimmune conditions, as well as the flare-up of autoimmune conditions. So how does stress do this? Some people think this is pseudoscience, but it's actually not. Stress stimulates the HPA axis, which is the hypothalamic pituitary adrenal axis. Hypothalamus is in the midbrain. The pituitary gland is just in front of that, and the adrenal glands sit on basically sit in the kidneys. What this causes is the release of cortisol, which is a stress hormone, and this results in an increase in inflammation, an increase in blood sugar, an increase in blood viscosity, an increase in blood pressure, as well as a long list of effects. And this interferes. Basically, what it does is it interferes with normal physiology, resulting in disease. Whenever physiology is in any way changed, that's basically what we call disease, dis-ease of physiology. And so yes, stress would be an important thing to get control of. Now, if If you can't find a way to manage stress on your own, I would advise you to start using adaptogens. Now, the problem with most adaptogens is they increase um, the immune system's, they improve immune function, which in an autoimmune condition you don't want. So you want to use an adaptogen that is an immunomodulator, not an immune booster, not an immune suppressant, an immune modulator. And for that, you'd want to use ashwagandha, which I've spoken about many times. Ashwagandha is an adaptogen, reduces the effects of stress, reduces cortisol levels, improves the functioning of the HPA axis, the normal functioning of the HPA axis. But you definitely want to go to a doctor and talk to a doctor about using these, because they can interact with the medications you are taking. And for many people, it may not be compatible with them. It may not be compatible with their metabolic type. So you definitely want to go and talk to an Ayurvedic doctor about this, as well as your regular doctor. If you're going to a PCP or even a naturopath, you definitely want to talk to them about this before going ahead and just administering these, especially since curcumin requires a metabolic booster and a drug carrier. So does ashwagandha. And boswellia is relatively safe to take on its own. But curcumin and ashwagandha do need to be taken and administered in the correct manner. Anyways, this was my take on inflammatory bowel disease. And if you'd like to get in contact with me, you can do so through my website, drnishal.com, doctornishal.com. And I look forward to seeing you in the next video.